Alcohol significantly impacts the brain. It enters the bloodstream and travels to the brain. Alcohol disrupts communication pathways. This affects signal transmission between brain cells. It impairs brain function, affecting balance, coordination, and judgment. This can lead to slurred speech and difficulty walking. It increases the risk of accidents and injuries. Long-term alcohol consumption can have devastating effects on the brain. Prolonged heavy drinking leads to changes in brain structure and function. One of the most significant changes is neuronal damage. Alcohol is toxic to brain cells and can cause them to shrink and die. This damage can affect various cognitive abilities, including memory, learning, and decision-making. Another long-term effect is Wernicke-Korsakoff syndrome, a brain disorder caused by thiamine deficiency. Alcohol abuse is a leading cause of thiamine deficiency. This syndrome can cause severe memory problems, confusion, and difficulty with coordination. It can lead to permanent brain damage if left untreated. Alcohol-related brain damage can also lead to mental health problems. People who abuse alcohol are at increased risk of developing depression, anxiety, and other mood disorders. These mental health problems can further exacerbate the negative effects of alcohol on the brain, creating a vicious cycle. It's important to remember that the brain is a complex organ, and the effects of alcohol can vary from person to person. Factors such as genetics, age, gender, and overall health can influence how alcohol affects an individual's brain. However, one thing is clear: excessive alcohol consumption poses significant risks to brain health. Adolescence is a critical period for brain development. Think of it as the brain's awkward teenage phase. During this time, the brain undergoes significant changes in structure and function. It's like a renovation project that never ends. These changes continue into a person's mid-20s. Yes, your brain is still figuring things out even when you're old enough to rent a car. Introducing alcohol during this crucial period can have long-lasting and potentially irreversible consequences. It's like adding glitter to wet paint. It's not coming off. Teenage brains are particularly vulnerable to the harmful effects of alcohol. Think of them as delicate soufflés. Handle with care. The developing brain is more sensitive to alcohol's effects on brain structure and chemistry. It's like trying to build a sandcastle during high tide. Alcohol use during adolescence can disrupt normal brain development, leading to problems with learning, memory, and impulse control. Imagine trying to do algebra while riding a roller coaster. Early alcohol use is also linked to an increased risk of alcohol dependence later in life. It's like signing up for a lifetime membership to a club you don't want to join. The earlier a person begins drinking, the more likely they are to develop alcohol problems. It's like planting a weed in your garden and watching it take over. This is because early exposure to alcohol can alter the brain's reward system, making it more likely for someone to crave alcohol and develop an addiction. It's like giving your brain a taste of candy and then hiding the jar. Parents, educators, and healthcare providers play a crucial role in educating young people about the risks of alcohol use. Think of them as the brain's personal trainers. Open communication, early intervention, and support are essential in preventing underage drinking and promoting healthy brain development. It's like giving your brain a VIP pass to a better future. Section 4. Understanding alcohol use disorder. Alcohol use disorder, commonly known as alcoholism, is a chronic relapsing disease characterized by an inability to control alcohol consumption despite negative consequences. It is a complex disorder with both genetic and environmental factors contributing to its development. AUD affects the brain in profound ways. Over time, alcohol abuse alters the brain's reward system, leading to cravings and an inability to control drinking. It also damages brain regions responsible for decision-making, impulse control, and memory, making it difficult for individuals to stop drinking even when they want to. The symptoms of AUD can range from mild to severe. They include a strong craving for alcohol, an inability to control alcohol intake, withdrawal symptoms when not drinking, tolerance, which means needing more alcohol to achieve the desired effect, and continuing to drink despite negative consequences. Treatment for AUD typically involves a combination of behavioral therapies, medication, and support groups. Behavioral therapies aim to help individuals identify and change their drinking behaviors, develop coping mechanisms, and build a support system. Medications can help reduce cravings and manage withdrawal symptoms. Support groups provide a safe and supportive environment for individuals in recovery. Gap 3S. Section 5. The social impact of alcohol abuse. Alcohol abuse doesn't just affect the person drinking, it has far-reaching consequences for their family, friends, and community. Relationships often suffer as trust is broken and conflicts arise. Families may experience emotional turmoil, financial strain, and even domestic violence. Children of alcoholics are particularly vulnerable, facing increased risks of neglect, emotional trauma, and developing behavioral issues themselves. On a broader scale, alcohol abuse contributes to societal problems like crime, accidents, and healthcare burdens. Communities may see higher rates of drunk driving incidents, leading to tragic accidents and loss of life. The economic cost of alcohol-related issues is staggering, with billions spent annually on healthcare, law enforcement, and lost productivity. Understanding the social impact of alcohol abuse underscores the importance of prevention and support programs. Community initiatives, educational campaigns, and accessible treatment options are crucial in mitigating these effects and fostering a healthier society. Gap 3S. Section 6. Prenatal alcohol exposure. A serious concern. Prenatal alcohol exposure occurs when a pregnant woman consumes alcohol. Alcohol passes from the mother's bloodstream to the fetus, causing potential harm. This can have devastating effects on the developing brain and body. Fetal alcohol spectrum disorders, FASDs, are a group of conditions from prenatal alcohol exposure. These disorders cause physical, mental, behavioral, and learning disabilities. There is no safe amount of alcohol during pregnancy. Pregnant women should abstain from alcohol entirely. Healthcare providers play a crucial role in educating and supporting women. Section 5. Prenatal alcohol exposure. A serious concern. Prenatal alcohol exposure occurs when a pregnant woman consumes alcohol. Alcohol passes from the mother's bloodstream to the fetus, causing potential harm. This can have devastating effects on the developing brain and body. Fetal alcohol spectrum disorders, FASDs, are a group of conditions from prenatal alcohol exposure. These disorders cause physical, mental, behavioral, and learning disabilities. There is no safe amount of alcohol during pregnancy. Pregnant women should abstain from alcohol entirely. Healthcare providers play a crucial role in educating and supporting women. Please like and subscribe for more content.